This is Travis Taylor, Healthcare Administrator and Educator of Voyager Home Healthcare, General Orientation, Section 3 through 5.
Okay, now we're going to talk about harassment. After this section, you should be able to identify the legal and policy requirements regarding harassment, recognize what makes up harassment, and identify the steps to report harassment. It is the company's policy to prohibit and prevent harassment in the workplace based upon race, color, religion, sex, national origin, age, marital status, disability, sexual orientation, veteran status, genetic information, or any other category enforced by law. State and local civil rights and fair employment laws also do not tolerate harassment in the workplace. We will take immediate action to correct any such situations. Violation is ground for disciplinary action up to and including termination. This also applies to company trips, off-site meetings, and company-sponsored events. There are two types of harassment. The first is tangible employment action harassment, which derived from the term quid pro quo, meaning this for that, involves monetary loss or significant changes in someone's workload or assignment because he or she refused to consent to someone else's unwelcome behavior. An example of monetary loss or change would be being passed over for promotion or raise. The second type of harassment is hostile work environment harassment. This occurs when an employee or contractor is exposed to unwelcome and/or persistent or severe treatment because of his or her membership in a protected class. This conduct must be so severe and pervasive that it is unreasonably unfair and interferes with job performance or creates an intimidating, hostile, or offensive work environment. An example of this would be sending offensive emails. The following are some examples of conduct which may constitute a hostile work environment. The first is oral or written abuse and/or threats, gossip or sexual comments, sexually explicit, derogatory, or demeaning visual displays, demands to provide sexual favors or unwelcome physical contact, including touching, patting, hugging, or pinching. Who can commit harassment? Employees, contractors, patients, vendors are just a few examples. Pretty much employees at all levels of the company may commit harassment or be victims of harassment. It is also important to note that harassment is not just committed between members of the opposite sex. Some ways to prevent harassment in the workplace from becoming a hostile environment include incidences must be immediately reported. We cannot take corrective action unless we know a problem exists. The company encourages reporting of all actual or perceived incidences of discrimination or harassment regardless of the offender's identity or position in the company. The company must be made aware before we are able to act, prevent, and stop it. You also must report the incident as soon as possible. If you believe you have been subjected to discrimination or harassment in violation of the policy, or if you have witnessed such discrimination directed at someone else, please immediately report the incident to the Human Resources Department. The company prohibits retaliation against anyone who complains about discrimination or harassment or who participates in an investigation. Next, we're going to talk about patient rights and responsibilities. By the end of this section, you will be able to support patient rights and responsibilities and determine the information that must be shared with a patient prior to rendering care. Patients have the right to obtain notice of their rights both verbally and in writing before they even receive treatment, receive notice of charges, responsibility, and coverage of the services being administered, participate in care planning, choose to refuse treatment and/or services, receive treatment that is free from mistreatment, neglect, and abuse, assess treatment and services without discrimination. Receive information about advanced care directives. Be advised on all services and care provided, including type and frequency of visits. Choose my healthcare provider. They can see someone else if they don't like the way they are being treated. voice grievances and complaints, use the integrity hotline, have health information kept confidential at all times. If a patient is believed to be incompetent or mentally incapable of making informed decisions, the patient's rights may be exercised by the patient's guardian, power of attorney, or other qualified legal representative. Patients also have certain responsibilities which include notifying their healthcare provider of cancellations or changes in shifts, have a backup care provider. If they end up receiving healthcare at home, they should have the equipment and materials needed to receive services, familiarize their provider with their home and preferences, communicate concerns and requests regarding changes in their schedule, provide emergency contact information, inform their healthcare provider of any previous hospitalizations, follow their treatment plan, never give their healthcare provider any gifts or ask for them. Next, we're going to talk about diversity. By the end of this section, you will be able to recognize cultural differences in others, define diversity, and determine the steps needed to understand diversity. Diversity is a state of difference, unlikeness, variety. Diversity in the workplace refers to the variety of differences between people. Diversity includes race, age, gender, personal appearance, ethnicity, nationality, sexual orientation or preference, disabilities, and religious beliefs. Can also include background, education, cognitive style, personality, and organizational function. Diversity supports differences. The value of diversity promotes new ideas and perspectives. Accreditation organizations such as HCHC and the Joint Commission require healthcare professionals to receive training on how to provide services to diverse populations. Centers for Medicare and Medicaid Services, or CMS, encourage healthcare organizations to provide culturally and linguistically suitable care. Culture defined. Culture is the behaviors and beliefs characteristic of a particular social, ethnic, or age group. Different cultural backgrounds and beliefs can influence a person's lifestyle, habits, communication preferences, view of health. It is important that you understand how your patients and their families' cultural beliefs may impact the way they look at healthcare. You can find out a lot about a person's preferences and beliefs by asking questions, speaking with the person, studying their behavior to gain more information. According to the HHS, effective health communication is just as important as clinical skill. Healthcare providers need to recognize and address the unique cultural, language, and health literacy of diverse peoples and communities to enhance an individual's health and build healthy communities. If you offer care to a patient and you find you are having trouble understanding each other, then it may be time to bring in an interpreter. When using an interpreter, it is important that a healthcare providers follow some guidelines. These guidelines are: tell the patient that the interpreter will translate everything that is said. They must stop speaking after every few sentences. When speaking or listening, look at the patient, not the interpreter. Ask the interpreter to repeat exactly what was said. Use visual aids written in the client's language to reinforce verbal interaction. In the end, the ultimate goal is a healthcare system and workforce that can deliver the highest quality of care to every person, regardless of race, ethnicity, cultural background, or English proficiency. Respecting diversity means understanding everyone's differences and responding to them positively.